This woman is the latest arrival at a cholera treatment centre in Haiti's capital. She joins several dozen other patients here at varying stages of the disease. Since the waterborne infection arrived in Haiti a few months after the 2010 earthquake, it's claimed some 9,000 lives. Nearly all of those who make it here will survive now they have access to medical rehydration, but outbreaks remain a worry. There's been a cholera alert here on the outskirts of Carrefour, near Port-au-Prince. Now teams are going house to house with disinfectant.
We've decontaminated the house where the case was found. Then we decontaminated the 20 nearest houses to create a protective barrier.
The infected person has already been sent for treatment, but they're not the only ones to have suffered from cholera here.
Look, I was like this, crawling like a baby on all fours. This is what I was like when I had it. You lose a lot of water. Lots of clear water just runs through you.
As well as sending decontamination teams, the UN, with partner agencies and the Haitian government, also give out water purifying tablets and leaflets to educate about basic cholera prevention. The question of how the disease arrived here is hotly contested. The strain of cholera exactly matches one found in Nepal. UN troops had recently arrived from that country when the outbreak began. Journalist Jonathan Katz says it's clear that the poor sanitation he uncovered at their base is behind the epidemic.
What we're looking at is about as close as you can get in science to a slam dunk. Even if it was going to be difficult in those early days to show beyond a shadow of a doubt that the United Nations was singularly responsible for introducing the epidemic, it was very clear from the very beginning that the United Nations was actively engaged in covering up.
A lawsuit is now being brought against the UN in New York on behalf of Haitian cholera victims. But the local representative for the UN's World Health Organization says the focus on how the disease arrived is unhelpful.
For me, what preoccupies me is not so much, who is bringing, because we are in a free world where everything is circulated. What preoccupies me is that today we have the risk of Ebola, we have the risk of measles, we have the risk of, many of those other diseases, and the investment for preventing them is not there.
The WHO is now coordinating closely with Haiti's government, Médecins Sans Frontières and others in cholera treatment efforts. But with the urgency of the earthquake now over, it's getting more and more difficult to raise funds. Without new commitments from donors, cholera is likely to remain a grim part of life in Haiti for years to come.